This video is to understand the importance of goal setting, provide goal setting strategies for physical therapy patients, learn the principles of goal setting and other goal setting strategies, and identify problems with goal setting, as well as process and outcome goals.
Gary, what, kind of as you think about your career, what is sort of the secret or the key to your success, do you think?
I think number two, I discovered early on my passion, which is, you said in introduction, is goal setting. I discovered that somewhat fortuitously, but nevertheless, I was aware of it at the time that I was doing my PhD.
Like you said, I have goals, and when I want to do something, it's about what I want to do. It's not what someone else wants me to do. And if I come short, then I'm going to readjust my goals and hopefully get there sometime in the future. But I try not to really pay attention to anyone else's expectations. I think my coach and I have the goals that we want to accomplish, and we go from step to step, and hopefully we get there.
Come on, boys, last 200.
I can only control myself. I can't control what anyone else says or does. So, yeah, it's just me sort of getting up there and just doing what I want to do. I've done this for, it's my 10th year, really setting goals and trying to achieve them. That, I trust the teamwork between Bob and I to get there, and I trust the goals that I make and the judgment that I have.
Goal setters often struggle with setting goals that enhance motivation and effort and provide direction.
I invite you to stop just setting goals and start paying attention to the behavioral changes you need to make to get there. By understanding the key activities necessary and committing to them as part of the goal setting process, you set yourself up for success. Studies have shown about 70% of us actually set goals, but only 8% actually achieve them. Think about that, only 8%. And this discrepancy comes from a fundamental misunderstanding around what goal achievement entails. People confuse setting goals with achieving them, forgetting the critical role that behavioral change plays in the process.
Hola, mami, ¿cómo está?
Hola, bien.
As a physical therapist, you will formulate your own plan, and the patient has their own goals too that you want to work and integrate together. Everything is good so far? With Anna, I helped her gain her strength back. I taught her exercises that she needs to do daily to improve her strength, her balance, her function in terms of walking and transfers.
El dedo, afirme, talones, alta.
I always tell my patient, you don't get better because of the therapist, you get better because of you.
Descansa, mami, respire para la nariz, suple la boca 3 veces.
We're there to provide services and guide them to the right track, where to go next. We initiate the treatment, we initiate the process, and that's very important.
So everything is falling into place.
Movement goals for PT patients tend to last longer, feel more achievable, and relatable to an individual's life.
We see a large variety of patients and do anything from getting them walking again, getting them in and out of bed, getting them into a chair, doing exercises with them. We want to have the patient be as functional as possible before they go home.
What makes up the key elements of goals? Well, let's use the SMART acronym. First, they need to be specific. They need to be geared towards patient-specific or client-specific learning or task or ability accomplishment. Secondly, they need to be measurable. We need to be able to define the level of assistance or the results of tests and measures, how long or how often they'll be able to do certain things, how well symptoms will be able to be controlled. Some quantifiable standard that we're seeking to achieve with this patient to say, yes, they've met this milestone. Thirdly, attainable. Is this reasonable for the patient? Is this considered consistent with evidence-based approach to care. Fourth, is it relevant? How does this improve or stabilize the health condition, the diseases, the disorders, the impairments that result from them for this individual to support optimal activity participation in normally occurring things that are important to that patient to be safe and independent in that home, okay? And finally, time bound. Now, I know we don't have requirements for lengths or short and long-term goals, etc. But if you go back to your practice, therapists, nurses, we know that typically we can put defined time frames for how long it would take us to expect to get there. We know that if we have certain goals, we have to work on those first before we get to other goals. All right, so they may be seriesed in a certain way where I'm going to teach you the exercise program in the first couple weeks and make sure you're following through. And then subsequently, the effects of that are going to improve your muscle strength. And we expect to see that carry over to community reintegration and the ability to walk the distances you need to walk to re-enter the community, right? So we have time frames that we can build that aren't bound to short and long term, but maybe more in individualized care planning, are a representation of our skills, our expertise, and our judgment.
There are 12 principles of effective goal setting. First, set specific goals. This is more effective for producing behavior change compared to do your best goals. Set moderately difficult but realistic goals. Goals have little value if no effort is needed to achieve them, and goals that are too difficult to achieve can lead to frustration, low confidence, and poor performance. Set long-term and short-term goals. Long-term goals provide direction, and short-term provides the steps to get there. Set process and outcome goals. Set mastery approach versus performance avoidance goals. Set practice and competition goals. Practice goals can help maintain motivation during long practice hours. Record your goals. This will help make goals in sight versus out of mind. Develop goal achievement strategies. What will you do that will help you achieve your goals? Consider participants' personalities, motivations, and learning status. This influences the goals the person adopts and how well the goal-setting process functions. Foster an individual's goal commitment. Provide goal support. Provide evaluation of and feedback on goals. Goal evaluation strategies should be initiated at the start of goal setting, and the feedback should be consistent.
I'm Dr. Chris Carr. I'm the sport and performance psychologist at St. Vincent Sports Performance. Today's topic is talking about effective goal setting and how we can move into achieving those goals that are important to us as athletes and performers. There's a lot of challenges to knowing what you want to do. Even regular exercisers, what's the goal of exercise? Is it losing weight? Is it potentially gaining fitness? Is it running your first mini marathon? But in all the years I've worked with athletes, I know there are some characteristics about goal setting and some basics that I want to talk to you about. First of all, understand the difference that goal setting is about outcome and about process. The outcome is where you want to be. The outcome is the end result. Winning a medal, making a team, losing so many pounds, getting a college scholarship. So in some ways you have to know where you're going, and outcome goals can be helpful. But the reality is once you've defined where you want to go, you have to better define the process. And that's what we call process goals. We want to focus our energy on process goals. Those goals that you do every day to help direct you towards the outcome that you want to achieve. But if their only goal is to win, they challenge disappointment. That's one of the effective strategies of goal setting, is knowing the difference between my outcome and my process goals. Let's talk about process goals. One of the things that goal setting really measures for us as psychologists that work with athletes is an individual's motivation. We know that individuals that have high internal motivation are very good with goal setting, particularly process goals. If I'm an athlete who's only motivated by external reasons, praise, rewards, those types of things, it's going to be a challenge to do these process goals. But if I truly believe I want to be the best that I can be, whether that's a high school junior varsity team, whether that's a college Division I program, or on an Olympic team, your goal is to find what's your best and be able to define how do you get that better.